coverage. Nigeria has received vital medical supplies worth about $22 million donated by the European Union and the United Nations. The items were procured through the One UN COVID-19 Basket Fund. Our correspondent Mayor Thomas reports.
The rising number of confirmed cases of coronavirus public health crisis is becoming alarming in Nigeria. This has put some stress on medical supplies and healthcare workers. Recently, the Nigerian Medical Association threatened to go on a strike over unpaid allowances and short supply of PPEs. While the federal government has promised to pay up the allowances, the United Nations and the European Union, under the One Basket Fund, has procured medical supplies for the country. The shipment contains 545 oxygen concentrators, more than 100,000 test kits, infrared digital no-touch thermometers, personal protective equipment and laboratory supplies. These are to boost the country's response to COVID-19 and care for the patient of the virus.
We are in a very difficult situation in the world in general. It is a very trying moment for our common humanity. We are still extremely concerned about the magnitude and impact of this pandemic in Nigeria. For some of us, we are just starting to see the magnitude of the problem. So whatever we're able to do today with our partners, together with the government, to actually try to address this problem is so timely.
What is so beautiful about the work that we are doing here is the togetherness under the leadership of the Nigerian government, of the PTF, that have taken bold and courageous measures to protect their citizens. But together with the United Nations as well, demonstrating the possibility to do multilateralism in practice.
The Minister of Health, who received the items for the federal government, says the supplies will help patients, especially the oxygen concentrators.
Of particular interest to me here are the 145 oxygen generators here, which we are beginning to see are a lot more required in our country, even more than ventilators. We still welcome ventilators. But speaking with the Honorable Commissioner of Health in Lagos State the other day and asking him, how many ventilators are you actually putting into use? Out of 400 cases, is using only 4. And what do you need most? Many of my patients do well with oxygen supplementation, he said. We need oxygen concentrators. And I said to him, we have to look for oxygen concentrators. And today, 145 oxygen concentrators have arrived. And we shall make the best use of them.
The Nigerian government and other international agencies are making the best of these very trying times in combating this virus. The call now is to every Nigerian to make sure that they are taking responsibility individually by staying safe. Moya Thomas, CVC News, Abuja.